Hi, my name is Lim Lee. I'm the nurse practitioner student from U.S. University. Today, I will do the abdomen exam on you. Before I get in the room, I will check your chart and then gather all the supply, wash my hand, get in the room, provide your privacy. First, I want to identify your patient and then the consent. Is it okay for me to upload the YouTube for my instructor to see it?
Yes, I do. And my name is Tino Chan, and my birth date is August 2nd, 1972, and I do agree with the consent.
Oh, okay. Thank you. Okay, let's do it. Can you lay down for me first? And so I can start my exam on you. Thank you. Let's lay down. Okay, lay down. Relax. Can you help me pull up your shirt so I can see your abdomen area now? I want to do the inspection to look at the shape and the color of the skin. So now I look at it. It's like a little bit round, no distinct, and no hernia, no redness, no aside, and no open wound. Abdomen, the color is okay, appropriate with the race. And after that, I will do escorting. I want to hear all for acquiring, to hear, make sure it's normal, active. I divide for acquiring. This acquiring is normal, active. It's normal, active. And I go to another acquiring. And okay, I look for the tinkling, pinking, and singing of vowel sound. And it should be 5:30 per minute. While I'm escalate, I can listen to the lever. The lever. And the spling to hear any friction drop. I YouTube bell and listen to aorta, renal, arterial, iliac arterial, and femoral arterial. While I auscultated, I didn't hear any proof, which one underlie there is no obstruction or possible murmur. So, if doing so, it will be abnormal. I will do the percussion and look for the tympanic sound over 4 quadrant. The doing sound usually abnormal or the organ fullness or further complication. Okay, and this is liver area, liver donors is present, and I try to do the edge of the liver, the percussive, and the liver. You see this area, like the rib. So usually have the doon sound. Okay, and then at the end, I can see it. Liver will measure to around 6 centimeter, and then the spliness donut is harder because it's difficult to get to the spleen because it's located far away behind the rib cage. Okay, so now I do the percussion on the spleen. Okay. Okay, finally I can hear. It's very hard to get the spleen donut. Okay, so now the next step, I will ask the patient try to take a deep breath and try to find out if the spleen is swollen or not. So, okay. So next I will do the palpation, light palpation around all the up corner. So from light palpation to deep palpation, so I ask the patient to take a deep breath and then to find out if the patient have any pain, discomfort, liver were palpitated with inspiration. Take a deep breath, please. Okay, are you in pain? Okay, no pain, no discomfort, noted. And then spleen were
I'm
not
going to check
palpable
on
with
the
inspiration.
spleen side,
Okay.
do the same technique.
This is a good sign
And then
because
the spleen is harder
the
because it's
spleen,
like hide
oversight,
behind
it
the
can
cage.
lead to further
Okay,
complication.
so I want to
And
make
next,
sure
I
the
will do some
patient take
special
a
test.
deep
This
breath
patient that
because
does not have a size, so
you know,
the test should
the
do
rib, if you
for
pull up,
education
if
purpose
you
only.
practice the rib,
First,
they go
I
into
want
be
to
doing
do
sounding.
the
So I
shifting
want to
donors
put
test for complete
in between the rib until I
on a
hear the
side in
donors.
abdomen.
And then
So
I want
abdomen,
to
I will
mark
focus on
that
top and support to hear tympanic style
because
in the middle,
the
while
spleen
the
is
dorsal
completely
here
under
over
the
the
rib
side
and up the
due
side.
to gravity.
So what I do is in the around 10 rib, sorry, CC around 10 rib, 10 is the costal space, so count the rib. I know the bottom rib is number 12. And in the anterior axillary line, so it's okay. I can focus here. And if that's due, it means the patient maybe
because it may lead to
the
further
spleen is shifting
complication.
up, so no
Now I
splenic
want to start
enlargement.
some special tests
Then
for the patient. Okay, this is I want to check the Murphy side. The test will complete and were negative. I ask the patient take a deep breath and I keep pressed on the right upper quadrant, press it down, and then if the patient deny pain on expiration, so the patient is negative for cholecystitis.
I will look for the McBurney side here. This is the bone, and then between that go to the umbilic, the belly button. In between it will be McBurney side. This side will help indicate the patient have an appendicitis or not. If the patient feel most of the pain when I press into that area, it means the patient have positive with McBurney side. Now, I will do the rolling side. I apply rebound pressure to left lower quadrant while the patient will feel discomfort pain in the right left quadrant. If the patient don't feel pain, it means he negative for appendicitis. Next, I will apply for the CVA tenderness test. And if the patient negative for CVA tenderness test, when I apply the foam palpation and the patient deny pain and tenderness, it means the patient show no kidney infection or any kidney complication. Now I will ask the patient to raise his thigh against my hand and flex his knee a little bit. Press up again my hand. Good. Okay. Are you in pain? No pain. Do another side, same thing. Okay. If he not in pain, it mean okay, it's good. It means the patient don't have any peritonitis or any peritoneal inflammation. Now I'm going to let his knee just turn around to see if externally rotate, internally rotate to see if have any pain or discomfort or not. If he have a pain and discomfort in that abdominal area of McBurney point, it indicates the patient have an appendicitis or peritonitis. The last one I want to talk about, one more test, is called Shipping Dunas test, and this all focus on ascites in the abdomen. I will focus around abdomen. Can you lay around on the other side, please? Abdomen will focus on top and tympanic sound heard in the middle, while doing sound heard over the patient will lie on the other side and the fluid shift due to gravity. Okay, go back. Okay, thank you. Okay, and then I continue percussion. Okay, I asked him to put the hand, and so I can see the fluid shift. Left side of abdomen facing the cell in percus was supposed to be tympanic sound, as all the fluid will shift to the right side due to gravity and was done in sound. Also, when I push on the fluid on one side, I can look at it and I can see the waist, the slap on the other side. The fluid shift test or the fluid weight test for ascites that conclude on our dominant stem. Do you have any question for me more? So I just want to know you don't have any ascites, and the test was done for education purpose only. Thank you very much for your help, and we'll get back together again for the next exam. Thank you.